Hi, so this is going to be part one, general senses of the senses chapter, outline chapter 18. So please have your outline with you. I'm going to let you guys read the cartoon on your own, and it has to do with the fact that your sense of smell is tied in with your limbic system, if you remember from chapter 16. All right, so let's talk about a general sense. So your senses of the body are divided into two categories, general senses and special senses. General senses are what you see here. They are general because they are spread out through the body. So different body parts, different organs can feel many of these general senses. Proprioception, remember, was the sense of the position of your body. And so this is going to be through different, muscles and tendons. Special senses are tied to just one organ, right? So your smell is through your nose, your vision is through your eyes. And so those are considered special. So let's talk about the general senses here. Let's move. So the first thing we talk about in terms of just being able to sense the world is the receptors, right? So your ability to know what's out there in the world is basically confined to what kind of receptors do we have. There's all kinds of things that we cannot detect. We can't see different shades of infrared. We can't see ultraviolet, but there's animals out there that can. We can't see microwaves, or radio waves or other kinds of the other portions of the electromagnetic spectrum. We can't hear wavelengths of, sound waves that dogs can. So we're limited. And so it's the receptors of our body that really tell us what's out there in the world, or it's what shapes our reality of the world. So let's talk about receptors. So there are two kinds of receptors. There's naked, or these free nerve endings, which do not have any connective tissue around them. And then there's another one called encapsulated nerve endings, which have a capsule or connective tissue around them. So basically, you want to understand that when you have a free nerve ending, there's nothing to block or mediate the stimulus coming in. So these nerve endings are going to be able to be stimulated by various forms of stimuli. So if you look at your outline where it says they're unspecialized, so many different stimuli can cause pain. Just think about all the different things that can cause pain, right? So extreme temperatures are painful. If you have an infection and you have, or like a rash or something, the chemicals that are produced by your immune system can cause a lot of pain because those chemicals can irritate those free nerve endings. Pressure, excessive pressure can cause pain. Just many, many different things can cause pain. So the reason is because these nerve endings are unspecialized. So temperature and pain are both mediated through these naked or these unencapsulated nerve endings. If you look at the opposite, right? So if your nerve ending has connective tissue in a special arranged fashion, right? These nerve endings will be shielded from this extraneous stimuli, and they're only going to be stimulated by sort of the one stimulus that is designed or it has evolved to be felt and modified through the connective tissue. So let's take a look at one very example that we've talked about before. So this is our Pacinian corpuscle. Here's our nerve ending in the middle, and then here's many, many layers of our capsule or connective tissue. So we can definitely see that this nerve ending is shielded. It's not going to be stimulated. It's not going to fire an action potential from just anything. It's going to, whatever stimulates this has to, the stimulus, right, has to move through or somehow pass by all these layers of connective tissue. And if you remember what this is for deep pressure, right? So you actually have to push down with enough force on your skin to deform all the layers here until you get to the single nerve ending there, and it can create an action potential. So when you modify or when you encapsulate nerve endings, you specialize the nerve ending. That's sort of the big picture there. Okay, so you have lots of different kinds of nerve endings. There's free, there's many, many different kinds of specialized ones. All right, so let's talk about the receptive field. So our receptive field is going to be the area of your body that's monitored by one nerve ending. And the receptive fields are going to be different sizes throughout the body. this is an example on the skin. So let me just give you an example of what you might feel. So let's say I take a toothpick and I put a toothpick on one receptive field, right? So you're going to feel one toothpick sort of stick on your skin. If I have two toothpicks and I put them both onto the same receptive field, you will still feel one toothpick stick or prick, right? However, if those toothpicks were far enough apart or actually hit two different receptive fields, then you will feel two distinct toothpick pricks. So what I'm getting at, right, is your receptive field is there's different sizes on your body. And so in your notes, you're going to see the sentence, right? The larger the receptive field, the harder it is to pinpoint the stimulus, right? The location of the stimulus. So in this receptive field, if the toothpick was over here, right, you don't know that it's over here at the edge of your receptive field. You just kind of get this general idea that there is a toothpick on your body that's in this region, but you can't isolate the region. So let's take a look at your receptive fields on the body. You have different sizes. Your tongue is very sensitive, so it's able to discern the exact location of a stimulus within 1.1 millimeter radius. So it's very good at locating a very specific location of the stimulus. Your finger is pretty good and your back is not so good. So anyways, this is the receptive field. So your knowledge that your sensory nerve endings will come to a region, and the region it monitors is called your receptive field. All right. Let's look at our types of receptors, letter D. So the first one is called a nociceptor. That's a pain receptor. So any receptor in your body that will send a message that is going to end up being pain, right, in your brain is called a nociceptor. And you can feel pain all throughout the body. So you have nociceptors within the walls of your blood vessels, within your joints, you have, pain receptors on your skin, obviously. So anywhere you can feel pain, right, you're going to have nociceptors. One of the interesting things about pain receptor is that, or I guess just internal pain, is that sometimes it radiates out onto the surface of your body, and this is called referred pain. So this is not that well understood, but if your internal organs are having issues, let's look at the heart, because a heart attack is one of those things that people have heard of, that if you do have a heart attack, it's very common where you have this referred pain. The referred pain can shoot down your left arm. It can actually come into the jaw and come into the neck. So sometimes, I think this is a little bit more women will have like a jaw pain or a neck pain issue with a heart attack, whereas men will have more of this left arm pain. Don't quote me on that. I remember reading that somewhere. But anyways, that's going to be referred pain. So you have internal organ pain, but somehow it radiates to the surface, which is referred pain. All right, let's look at our second, thermoreceptors. Remember, thermoreceptors are just these free nerve endings, and they're going to be responsible for temperature. So your knowledge of temperature of the room is going to be through these thermoreceptors. Number 3, mechanoreceptors. So mechanoreceptors are receptors that are stimulated or inhibited by physical distortion. You physically have to bend or push or, somehow twist or somehow move that nerve ending physically, distort it physically. So one of the categories, right, we have A, B, and C under mechanoreceptors. One of the categories for a mechanoreceptor is tactile receptor, because that should sound a little bit familiar when we're talking about this Pacinian corpuscle, right? I told you you had to push your way through this connective tissue and then finally bend this process in the middle to actually fire an action potential. So that's a example of a mechanoreceptor. You guys learned this too, right? Remember the root hair plexus, how it wraps around the root of your hair follicle, and you know when someone is moving your hair. That's also a deformation, right? You have to physically move this guy. So it's not chemical, right? It's this physical process. When we look at, so I have a fun example here. So in open brain surgery, right? Does the brain have touch and pain receptors? And obviously, if you're looking at this, you're going to probably leading you to say no. So no, the brain does not have any touch receptors, nor does it have pain receptors, because really, the brain didn't evolve to be outside, it evolved to stay inside your skull, right? Under normal circumstances, if you were exposed to the brain, the person probably wouldn't be alive. So once you're in, right, the person would have to numb the skin and the bone to get into the brain for a brain surgery. However, once you're in there, the brain itself doesn't feel pain or touch. So this surgeon here can actually sort of stimulate different parts of this guy's brain. The patient who is wide awake here can actually feed back and verbally tell the surgeon like what's going on, what he's feeling, and so you can have this kind of open brain surgery without being under general anesthesia. So I'll let you read about the what's going on here with this man. So we're moving on to the baroreceptors. So baroreceptors are stretch receptors. So a barometer kind of feels pressure, right? The air pressure. So these are pressure or stretch in the organs. So you can see that we know our stomach is getting full because we have stretch receptors in the wall. Your brain, as your bladder fills with urine, the bladder stretches, and then that feedback on the stretch goes to the brain and tells your brain, oh, your bladder's super, super stretched. It's probably able to, it's probably time to go to the bathroom. So there's stretch receptors in the lung, in the colon. And then there's this very interesting, remember there's baroreceptors, the carotid sinus. So the carotid sinus should look familiar to you because in chapter 16, the cranial nerves, one cranial nerve would drop down to this carotid sinus region to monitor oxygen concentration, carbon dioxide concentration. And so this is the area you can also feel pressure. So blood pressure is monitored here and can feed back to the brain. All right, so that's baroreceptors. And then let's look at our last one, proprioceptors. So proprioceptors, right? So we're going to have these spindle fibers that are not muscle, but they are embedded within the muscle, and they can feed back to the brain about the stretch of your muscle itself. And then there's these Golgi tendon organs, which can feel the stretch of the connective tissue of your tendons. So you're going to find these in your joints, you're going to find these in the muscle, and also in the tendons. Before we move on to chemoreceptors, just one interesting thing about our phantom limb syndrome here. I will post this in the module so you can take a look at this little, I think it's only 4 or 5 minute video. So phantom limb is a phenomenon where a person loses a limb, but in their brain they still feel the pain of that limb. So they can, still have really extraordinary pain even though the physical limb is gone. That's phantom limb. So I'm going to let you guys, I'm going to leave it as a little bit of a cliffhanger. I'm going to let you guys watch that and figure out how they treat this. Okay, chemoreceptors. So chemoreceptors are obviously receptors that respond to chemicals. And I think when I ask you, where are your chemoreceptors in the body, where can you detect chemicals? You might say your tongue, right? Because the food you eat is different chemicals. And you would be right. But in terms of like generally spread out through your body, you find chemoreceptors in these regions because they need to monitor the pH. So if you think about pH, right, that's a chemical thing. That's the amount of hydrogen ions in your blood and in your tissues. So the pH is responsible, or the monitor of pH is by chemoreceptors, and also the concentration of carbon dioxide and oxygen can be monitored through chemoreceptors, and everything feeds back to your brain stem, and you can get these reflexes to adjust your breathing rate and your heart rate. All right. So here's a question to wrap up. Which of the following types of receptors are especially common in the superficial portions of the skin, in your joints, within the periostea of bones, and around the walls of your blood vessels? So all those different parts of your body, what kind of receptors are common in those regions? So you can think about it, pause the video if you want, but I'm going to go ahead and tell you the answer. The answer is nociceptors. Okay, so pain is going to be everywhere. Proprioceptors, this is not going to be found in your bones. It's not going to be found in your blood vessels. It's not going to be found in the skin. It's only going to be in joint capsules. Tactile receptors, remember touch is only skin, so it's not going to be found anywhere else. And then chemoreceptors for chemicals, right? Where are we going to find a chemoreceptors? Not anywhere here, right? Maybe in the walls of some of your blood vessels where you can detect pH and your oxygen, carbon dioxide, but nociceptors you'll find everywhere. All right, I think that concludes that concludes general sense.